Hi all, I am Meghali Malvia, Lead Event Execution Observe Now. I would like to thank you all for joining the ekincare Present HR Leaders virtual session powered by Observe Now. The topic for today's session will be workplace wellness strategies to address a changing healthcare landscape. Just to give a context on what Observe Now is, Observe Now is a young niche B2B digital media startup that curates exclusive knowledge sessions with thought leaders in education, human resource, startup, BFSI segment, etc. You can check us out on social media and our website. And now I would like to introduce our esteemed speakers, Mr. Santosh, HD, Manager Employee Experience, Syncron. Hi, Mr. Santosh.
Hello everyone. Pleasure to be on the panel today.
Same here. Then we have Mr. Sanjeev Sharan, Director HR of ZTE Telecom. Hi, Mr. Sanjeev.
Hi, thanks for inviting. I hope I'll have a meaningful session today and really look forward to learn from each other.
Thank you, Mr. Sanjeev, for joining us. Now, I would like to introduce our esteemed moderator, Ms. Deepika Vijaykumar. She heads people function in ekincare. Hi, Ms. Deepika.
Hello, hi Meghali, hi Sanjeev, hi Santosh. Glad to have you on the panel today.
Thank you, Deepika.
Great. Now, I would like Ms. Deepika to take the session forward. Over to you, Ms. Deepika.
Right. So a lot, I think, has changed post the pandemic, and today we will be covering a few topics around workplace wellness, specifically on the new initiatives that some of us may have implemented, and where do we go from here. So essentially, the agenda for today would be to understand where leading HR professionals are to go, to understand the importance of wellness strategies and the practical ways on how we address a changing healthcare scenario that we have in front of us. The pandemic brought with it a profound change in the way we perceive health and access care as a population. On the work front, employees are now more aware of it and are very engaged with their health today. Today's conversation will center around what employers can do to capitalize on this heightened interest to keep pace with today's new health landscape and guide their workforce towards improved wellness. Employees today are very eager for newer solutions, I feel, meaning it's very essential for us as employers to reevaluate our workplace wellness strategies to ensure we are proactively supporting the well-being of our workforce and by extension, the health of our own bottom line. So without further ado, let's quickly jump into our questions. And here's hoping to have a very meaningful conversation, and very, very happy to be collaborating with Observe Now for the 5th session now on workplace wellness. So let me start with you, Sanjeev. What do you think workplace wellness is all about? And do you think it's given more prominence from your vantage point based on your team members' wellness needs?
Yeah, Deepika, I think it's a very valid, very relevant question, which I think everybody around the globe will be talking about. Then one of the most important things, the impact of COVID has been that wellness and HR and the organization, these are the 3 pillars, which are 3 factors which have actually become very important, started playing very important role. And wellness, yes, pre-COVID and post-COVID, wellness has actually become very important because it is no more a subject or a tick mark subject. It has become a priority. It has indirectly or directly, it has become not only moral, it has also become a kind of the organizational KPI or the factor for the performance. Because a well set up or well organization or the healthy employees definitely are the key factors for the growth of the organization. So wellness has taken the front seat, and I'm sure the lots of the evolution and lots of the things would keep coming up to work towards it. But I'm sure all the organizations are doing something or the other towards it.
Santosh, would you like to also opine on this, please?
Absolutely, Deepika. Thank you for bringing me in. I think, I would definitely agree with what Sanjeev said. There has definitely been a lot of importance given to wellness post the pandemic. But I think the biggest change that we see is the paradigm shift in how wellness is perceived, right? Because the employee before the pandemic wasn't, not everybody among our employees were very keen, right? For that was not one of the driving factors why they chose an organization, for example, before the pandemic. There were other driving factors that took precedence. But I think post the pandemic, one important aspect that everyone is looking forward to is my company taking good care of my wellness, right? Is the place I'm going to go to next focused on my wellness and my family's wellness? It's not just the employee, but the larger family, because everyone has seen the impact a pandemic could have on the families of members, right, who are affected. So I think it is very, very important to have wellness as part of your strategy as an organization. And HR plays a vital role in driving it to every individual, irrespective of locations. And I say locations because not everyone works from an office today in one single place, right? So it has to be delivered to where they are. So it has taken that much more significance for the organization to have a proper strategy around it. It is not anymore about an annual health check at your campus or an eye check at your campus, or some drive that you do once in a while. It is not that. You need to have a strategy, have a partner to drive this as a benefit to the remotest parts of the country, right? So that it reaches every single employee and their family. So that is how significant it has become.
In fact, I think even with ekincare or even other companies, I think hiring has seen a lot of questioning now from the candidates, where not just the health benefits that are offered as a regular package. I think a lot of people are now concerned about what wellness activities are conducted by the employer on a regular basis. So I think it has changed the TA space as well for good. On that note, I would like to ask you, Sanjeev, how do you feel we can create a fine balance between workplace wellness activities and the healthcare benefits for employees?
Uh, Healthcare benefits and wellness. Wellness is probably it is the, I would put it, it is more like an OD of healthcare, because it is an expanded mode. You have to go beyond the benefits of it. Benefits, every organization has something, but it's all about the attitude and the organization strategy and the priority of that, how healthcare is being taken as a priority. So it starts from the management approach towards it. That is, organization from top down is concerned about it, because that is what the message goes down the line, that it is not only the business oriented, it is the overall oriented organization, which is the welfare or the growth or the development. The employees are the key factors which makes it. So that is how it is. And the benefits, I believe that it is a time that the organizations have, and I believe the organizations like ekincare and others plays a very important role, where it is we, the organizations, we are the users, we are the ones who are using these benefits, and we would like to extend it, but it is not our forte. It's not our forte, like facilities management or those kind of things. It is not the forte. Then you look outside for the experts. So I think that is with the uncertainty around, like COVID was uncertain, unpredictable, and the lockdown was 4 hour notice or 6 hour notice. So in that unpredictability and uncertainty, how the organizations can actually cope up with the setups, what kind of the setup, what kind of apps, what kind of the features are there, which can actually preempt it, that this is set, so that you don't get into the another kind of surprise. So that is what the mindset of the organizations have become, that let's start thinking on those lines, that unpredictability is not, we are ready to manage those unpredictability, uncertainty.
Right. I understand. So, Santosh, do you think in the days to come, we should be looking at wellness from a standpoint where we have a proper calendar which is followed on a month-on-month basis, because health benefits is something which will come with the CTC package. How do you think we should go about it?
Yeah, I think it's already started, not the future. I think right after the pandemic, when there were, I wouldn't say companies were not doing this in a strategic way before. There were a lot of them who had a very strategic, wellness focused approach, but employees probably did not value that as much. But now post pandemic, I think many companies, when they started thinking about how they're going to approach, asking people to come back to work or delivering these benefits, people now spread all over the country, right? I think many companies have already started having a annual calendar of events, trying to identify a partner who can help them deliver this, because very quickly, right, companies realized that the only strong point in terms of wellness that they were providing, right, was insurance, right, medical insurance, for example, right, and that really helped a lot of people during the pandemic.
Yes.
But I think they very quickly realized that it is time to go beyond this. It's an opportunity as well, right, for the organization. Companies that had good insurance policies, with good partners to deliver them, could give that benefit to their employees. And now they want to leverage this aspect of the focus on wellness, not just the physical wellness, also the mental well-being, as well as the general feeling that my organization takes care of me, right? That is what the management is aiming at these days. So I've noticed in many organizations, they have started calling out the kind of benefits, highlighting the wellness benefits that they have when they make offers to their new hires, or when they even pitch the organization, right? So like you said, TA is definitely already on the job doing this, where they are working very closely with people like us who are implementing these wellness as a strategy, to understand how it can be projected and communicated to the larger audience. So like you asked, it is not about the future. Companies are already doing it, and it has to be part of your overall people strategy. Wellness is not a one-off thing that you do every quarter to make people happy. It is something that has to be, if it's from a cost factor, you have to budget it, you have to have a partner or a system or a team internally to plan, strategize, and implement the wellness programs for your employees. And these not just are about physical wellness or a mental well-being coaching session, etc. It's also about various activities and sessions that improve the overall perception of an employee towards the organization's concern for their wellness. So that has to be the focus of the strategy.
Right, right. And how do you think we could improve the execution of such strategies once they are in place? How do you think we could improve the execution to make this a very viable investment from a long-term perspective?
Yes, I'll tell you, I'll give you a very classic example, right? So in Syncron, a couple of months ago, I'll go even before that. Last year, right, the beginning of 2022, we said all our employees can work from wherever they are. They don't have to relocate to their base locations, right? So that was one move that was really appreciated, and we did that as a pilot for a year. Okay, and as soon as we approached the last quarter of 2022, employees started coming back to us with a concern saying, what's going to happen in 2023? Are you going to ask us to come back? Now we have already relocated to our hometowns. I have put my kids to school there. So life has moved on for a lot of them, right? So now as an organization, we could have done three things. One is those who are here have to come to office in their base locations. Those who are in different locations could continue from working from where they are, or everyone has to be in office, or everyone can work flexibly as we had, right? So the decision the organization takes is what builds that perception about the company's focus on wellness, right? So Syncron's management at the global level, this is not a local decision that we took, it was a global decision. And at the global level, though we have offices, we have invested in a lot of space, as a company, we have taken a decision that we will continue with this, which was a pilot in 2022, will become a permanent feature, right? Where the offices will be available for people who would wish to come and use them, and it's open. They can come and use them if they're part of that city. If not, you can continue working from wherever you are in your country of employment, right? So there is no need to really restructure entire family scenario, kids, spouse working somewhere, parents not wanting their kids to go away from them now, because we hear a lot of people telling us that during my one-on-one interactions with them saying, I want to relocate back to Bangalore, but my parents don't want me to go because after a very long time they've had me with them for a couple of years, and now they're not willing to let me go at all. They're getting very emotional. So these are the kind of impacts our decisions will have as an organization, right? So wellness starts from such very basic decisions. I'm not saying companies who ask people to come back have done a wrong thing. It's a strategy that they have, but maybe they're offsetting that with something else that is making things better for their employee. But companies can even make sure that their employees feel that their wellness is a priority for the management by taking such critical decisions as well. So that is the start of implementing these strategies. And if your management is into it, right, any strategy can be implemented in a very smooth manner. It is a buy-in and the culture that has to be built in, and that responsibility lies with the HR leadership to get all the members of the management together to buy this idea of wellness. That is very important. Then you will get the funding, you'll get the backing, you will get a lot of support to implement your strategies.
Agree, Santosh. I feel, I mean, in fact, when we were calling our employees back, after the third wave, or, even after the second wave subsided, there was a lot of resistance, because people had actually then realized that it is possible to have a work-life balance, which initially was just a notion that people would talk of in, on town halls or on meetings. But, they actually found that right balance between having a work life separate and a office life and a personal life separately. But Sanjeev, what is it other than the work mode segregation that probably you have done at ZTE, which has helped you in actually seeing an increase in employee productivity?
One of the most important things what we did was that we started the focusing on the peace of mind. Indirect peace of mind is the most important thing, because people had gone through lots of if they have not gone through it, looking at the TV and the news, and that had also played a major impact on their mindset. So one was that peace of mind. So the initial focus was more on that, whatever the medical and those assistant, health assistant, that the total focus for a couple of months, it continued for approximately 6-7 months, on that is on the EAP services and the peace, because we realized that the EAP services, and then also on the mental peace and the mindset is something which needs to be taken care, because you can measure that my temperature, you can measure the thing which is physically, which is visible, but something which is not visible has to be focused. And thankfully, that was something which was globally from across the 60-65 countries, the organization from quarter also it was driven that the comfort should be there. So when we started migrating from the work from home to work from office, the most important thing was that the message has to go that yes, when you're coming back, you should be comfortable that you are coming back into the comfort zone. You are coming back from one comfort zone to the comfortable zone. And that is what is there. So I would say that total, it was the mindset change of the organization and of the people. Both the mindset have changed. So that was one of the most important things. And second was that we started the more focus was on the awareness. Awareness is about that responsibility. Health is priority. It is not only someone else's responsibility, it is your own responsibility also. Start talking about it, start taking care about it. As a human being, we are the most important thing. One thing which we actually neglect is health. So that was another thing which I think I would say it was a positive thing that we started working on it, that start giving priority to health. And once you start giving priority, then everything becomes a habit. So you have to bring the wellness, the mind into mindset and the habit. So precaution, intention, and then practice was the mode what we worked on.
Nicely put, Sanjeev. In fact, there were a lot of concerns that were raised when, again, when we started calling people back. And I think we had to, as HRs, we had to start with making an environmental change. Not just, again, like you rightly said, in the mindset, but also in the surroundings of the office itself. I mean, there were a lot of changes that were made across a lot of organizations where they were talking about, more frequent breaks. There were a lot of adoption of gyms within the facilities. A lot of offices went beyond, their regular call of duty to actually accommodate all of these needs of employees. And in that light, I would actually want to ask, how, as HR leaders, do you suggest we can assess, create, and communicate the health needs of the team? Because that's where you start. That's where you figure out this is where you need a certain wellness program to come in. For example, I used to, work for a dental company, and the first thing that we used to talk about from a sales standpoint also is that a, a middle class person or anybody, right, would not go to a dentist until the pain really becomes unbearable. It's not something that comes as a part of your regular wellness program. But post pandemic, I think there has been a need that has come from employees, and for not just dental, not just for ENT, but for every particular organ, and the way you are able to take care of your financial needs, your mental wellness, all of these things. So where do you think we should start from assessing to creating and to communicating the health needs of our teams? Sanjeev, if you want to go first.
I'll just give you an example before addressing it. What we did was that the organization, just to create the awareness when it was work from home and then it was hybrid and then back to office, that all these they were different. We incentivized, or we started giving awards and competitions and those kind of things for the healthy activities. Like we had the competition globally. There was an competition for the workouts, the marathon running, and taking care of. So the objective was that if you are giving it when you're actually to make it more interesting, that people should participate, and the objective of participation was that they should start becoming more aware about the health thing. First, I will do it for the prize or the gift. The second, if I have done it for the 3 second or 10, 20 second or 1 minute or 2 minutes videos, when I have done it, uploaded it thrice, then I'll start doing it regularly. So the percentage of migration from the off and on to the regular increase. Second is, I believe, one is that the certain kind of the organizations have to, I believe we've started doing it. I think the organization is doing it is on the periodic some kind of, not only the awareness, the real kind of the health checks which is there, and the arena or the should increase. It should not be like, okay, the blood test is this. Probably there are lots of the surprises. So the test list should also increase. Secondly, is that the frequency needs also to be looked into it. Probably, I believe the time has come that the medicine should, or medical practices or the medical thing should also be integrated, somewhere be integrated or should be adopted in Asia. We have started doing it at the level, exact, not to actually have a medical practitioner, but some kind of those medical sensitivity should be there, which makes it as a thing. It should be a part of your routine or a part of your policy. Policy means not only that it is a checklist, it should be a serious policy. So when you start doing it, that will help the getting the employees ready for it. And trust me, it impacts the productivity. It impacts ultimately the organizations. While during the COVID, all the organization had the people first and everything was part. But gradually it cannot be a very long-term solution. The business is for business, and for the business you need your resources. whether it is human resource or technology, everything to be up and ready. So you have to focus. Like you take care of the AMCs of the equipments, the employees health AMCs mindset should be there.
So, I mean, as HRs, we are all, told that we are the flag bearers of our company's health, of our employees' health. What often happens is we are able to assess, we are able to create and, come up with workplace wellness strategies. And, there are millions of them that you can actually implement also. But when it comes to execution and then maintaining it as a regular process, there are a lot of challenges that come along. It could range from employee participation to challenges coming in from the management side. How do you feel we can overcome those challenges? Santosh, maybe if you want to take this question.
Yes. Right, Deepika. So I think I will take it from where Sanjeev left, saying productivity and of an employee is directly proportional to how well we take care of their wellness. Right, it's absolutely important. And to answer your question on how do we successfully implement it and ensure that it is running in a very successful way through the year and the next year, etc. It is a challenge, right? Anything when you talk about wellness and if you start talking about physical wellness and also more with mental wellness, people don't open up. They're very shy about using some of these benefits, right? Because they're not sure what is in there for them, right? Even for example, if you ask any of us to go and get a health checkup done, not every out of 10, probably 2 or 3 might volunteer. The 7 of them will have that hesitation saying, I feel fine, I'm all right, I don't have any issues, right? So this is the same mindset that people have. We have to build in that amount of trust, saying there is a focused approach as to why we have a health check in place. It is not just announcing that you have a health check as part of your wellness plan, but it's about tracking and advertising that to the employees, the benefits of a health check and how it can create a peace of mind for the employee for the rest of the year, saying, okay, at least for the next 6 to 8 months, I don't have to worry because my health parameters looks fine. I know what I need to improve in. I know what I am really lacking behind in. So these are kind of things that are designed to give you the mental, peace that you're looking at, right? Because you already have a lot on your plate from a work perspective, and your personal life also adds to your, daily rigors. So if you have a tool that is telling you that you're physically all right, don't have to worry, just take care of these 4 or 5 things, I think you can refocus a lot of your energies, right? So that is where the constant communication from a trusted source like an HR partner in the organization becomes really important, right? We don't really play the role of our traditional HR these days, right? So we are friends of the employees. So that's why in Syncron, we don't call ourselves HR at all. We call ourselves employee excellence. So if the employee has to excel, everything has to be taken care by us, right? We are the driving force behind an employee excelling in everything that he does. And without being physically and mentally healthy, you cannot excel in anything, right? So that is one of the biggest areas where we have to constantly build that trust among our people, that the organization's focus is not on any specific parameters about anybody's health, but the overall organization's physical and mental well-being, right? And the kind of tools and benefits we offer, we have to also communicate in parallel that there's a lot of confidentiality involved in it, right? The company is not interested in any individual's information, right? Everything is provided in a very generic way to an employee, and all the information that's gathered is treated confidentially, and they can peacefully go and use these solutions, and measuring the impact, right, of the benefits and strategies that we have implemented on a regular basis. Most of the times what happens is we implement something and we try to measure it at the end of the year, which probably is too late, right, to make any subtle changes that we could have done with the benefit during the year. And through the year, a lot of people lose interest because the steam just dies down because the companies the HR is not engaging with the employee about this benefit. In many companies, employees don't, some of them are not even aware that there is some benefit like this. They say, yeah, I know there's a portal, but I've never logged into it. So how do we encourage each and every person to have an account activated, have at least a footfall every week or every month? You don't have to book a consultation with a doctor, or you don't have to, really get a diet plan for yourself. You don't have to do anything, right? So simple things, right? What we have done is to start having people add their fitness bands or have a Google Fit app and start tracking their steps. So there's a lot of strategy that one can have around how we can encourage employees to participate in their own wellness plans, right? So participation is the most important thing. You can communicate as much as you want, but if that communication is not leading to participation, then you are not achieving much in your wellness strategy. Employee participation is very important. The biggest way to make it happen is through activities and involvement of employees in driving wellness programs. So that is why we have planned to design a lot of our activities around who is walking how many steps in a week, right? Have specific contests for people who are interested to sign up for it and then participate in it. We'll run it for 3 months and see who has burnt the most calories. The data might not be extremely accurate, right? There might be some scope for errors here and there, but then the overall goal is to make sure that at least 30 to 40% of your organization is engaged about this particular event. So if you have about 3 or 4 such events, I think you can at least cover 80% of your organization. There'll always be some part of the organization which will never sign up for anything that you do, right? But we will still try to at least get their attention, right? Whenever they have a need, for sure they'll open up and they'll wake up and they'll start using things. There's always a wake-up call for everyone. We try to tell people before that wake-up call comes to you, take precaution and be healthy, right? That is the agenda of the strategy. Sometimes it happens when the wake-up call already comes, but still, yes, I would like to summarize by saying frequent communication, regular measurement, and course correction whenever required, along with driving employee participation into wellness. That is the key for us to implement and continue to be successful with the wellness strategy.
Very nicely summarized, I should say, Santosh. So I think a lot of organizations also looked at giving a no questions asked leave for anybody if they had, an illness that they did not want to talk about. A few companies also came up with period leave, which was a no questions asked 1 day per month. Just adding on to that, there are a lot of employees who live with chronic health conditions. Some people probably live with arthritis, rheumatism, things that they don't speak of very openly. What as we, as employers or as HR professionals, what can we do to support, for employees with such chronic health conditions in the face of the changes in the current healthcare landscape?
Well, I'm thinking this is for me, right? So, okay. See, like I said, right, it is we have to start thinking wellness, right? When I say wellness, it's not about the physical illness at all, right? When you think about wellness of your people, because they are your most valuable resource. If you lose an employee, it is probably you're losing a lot of experience, knowledge of the domain and expertise of the product, right? And all the cultural aspect that they had brought into the organization. You're losing all of that. And if you have wellness of your employee as part of your core strategy, I think any of these scenarios that you mentioned should not be a difficult decision for an organization to take. It's just about the, for the leadership in HR, what I've realized is sometimes there are great ideas coming out of the organization's teams, right? But there is that inertia in the leadership to go ahead with the implementation of these strategies. They're not sure, right? So that is when you need a partner to help you with. So not all wellness strategies around wellness can be thought through and conceptualized by an HR professional. I don't believe in that, right? We are facilitators, but we need experts in that domain, right? So that is when you start thinking, okay, my team has a great idea for my employees. As a leader, what should I do next? There are a lot of them who sit on these ideas, right? And they try to do it their own way within the constraints of the organization. But if you try to work with a partner today, I think you have a lot of options, and there are partners who are willing to go the extra mile to deliver the best benefits for you. You just have to figure out and ask what you need, right? So that inertia from the leadership, right, has to be overcome. And only when you as an HR leader are convinced about an idea will your CEO or the CFO will be willing to fund and approve a decision, right? So if you yourself are holding back, then you won't be able to implement a great strategy. So
Right.
use expert support, prepare well, have a great idea and an execution plan and how it's going to be implemented. Have clear, budget, numbers in your mind. Understand what is feasible for your organization, what is not. Pick what you can implement, and then be confident in as a leader in what you're trying to do. Only then it will be successful, and employees will appreciate such an implementation.
Right. Right. So, Sanjeev, Santosh also spoke about preventive care, right? Of course, there's going to be a time in an employee's life where he starts to feel more seriousness towards, these wellness initiatives or even health benefits that an employer provides. But do you think technology here can be leveraged to support the workplace wellness strategies and help employees manage their health a little more effectively and also take a preventive healthcare into consideration?
Deepika, in fact, that is, see, the most important thing or something is that everybody has the lots of ideas, and organizations do not have the dearth of ideas. And post-COVID, there is always a spare fund for the health is there. Organizations have become that much liberal and that much conscious. Only thing which is missing is the consistency and standard and continuity. Probably the most important. And if these three things are not there, no organization, no management will be totally committed. Neither the employees will have that taste because the consistency is not there, continuity is not there, because it's an offshoot of that someone's engagement. So to have the, so I think the consistency, continuity, and the standard, the quality can only be done if you have something which is a kind of the dashboards and thing which is a technology. Like we started initially around a couple of years back, we used to have the dashboards for the manpower, those kind of things. There should be the wellness dashboards, which is easy to use. And why the consistency and continuity is not there, why people are really hesitant is that if it is not easy to use. So the role of technology should be like, it should be easy to use. And I know that this is where I have to do it, and this is my calendar. And this is these are the things which are handy. So out of 7 in a quarter, probably 3, 4 I will do it, but it is to be easy, accessible, and should be standard. And so only thing which can be done is not the technology. And technology is there because technology means it is data. Emotions you can question data, you like it or not, you have to believe it. So data are not wrong. So it has to be the data filled, all the initiatives, whatever the engagement things are there. I'm talking about the health wellness engagement. So the programs or the whatever it is, it has to be driven by data, and data which is supported by technology. So ultimately, I think the organizations where the role of the, and that was why I was suggesting that you need to have the medical mindset. That intent of medical mindset word was used was that to have that kind of the technological thing which is there. They are the experts who can actually drive these things, who will help you, because we as an HR professionals, we have might have the compassion, we might have the budget, but can we drive it regularly? Because there would be lots of compulsions. Today you are into this, tomorrow you are forced to go for the PMS things and other things. So technology will be is the only bailout thing, which is impartial, does not have any emotions.
Santosh, would you like to add to the point?
Well, I agree with what Sanjeev said, right? Technology is, a very a big driving factor here. And that is, I think that is reason why you see a lot of organizations like ekincare coming into this domain, right? Bringing in technology and merging that with wellness and how it can be delivered to, people. So that is the essence, which I think many companies have also picked up today, right? So uh, to be able to deliver effectively and measure, because your earlier question was on how to measure the impact, right? So if you are able to deliver effectively and measure the impact, you need data and you need technology. You need a constant partner who is gathering data, analyzing it, and giving you real-time information. So that partner is technology, the tool that you get from your wellness partner that you're partnered with. Right? And lot of these things cannot be built in-house, even though you are known to be a very good product development organization. You are not in the domain of building apps and systems for this. So you need to use, the right partner who has invested uh, in coming up with a robust solution, right? Which helps you with the data, with the strategy, understands your requirements, and comes up with something that is customized to suit your organization. So that is the need of the hour, which is why a lot of HR professionals, leaders today are looking at tools and technology as a partner or as a support system to implement wellness strategies. I completely agree with what Sanjeev said. And of course, the emotional aspect that he brought in, I think, is fairly justified as well, because data does not differentiate between anybody, right? So it tells you what the fact is. And you like it or not, that is the reality about healthcare as well. If your numbers are not looking good, it's not looking good. You cannot assume that I'm healthy, right? Which
Yeah.
is very, very important. It could be physical or mental well-being, but numbers speak the truth. So you need to be open to it, and the company needs to do the right thing, right? It's not just for the sake of providing a benefit. That is why I never said it's a benefit. We should probably project it as a benefit from a marketing perspective, but it is part of your HR strategy overall.
Right. So, to the both of you, right? While we get to measure how healthy our workforce is, I think as HR professionals, at the end of the day, everything, be it PMS, be it the budgeting activity, be it running these wellness strategy programs, I think everything boils down to productivity of the workforce, right? So, maybe as a parting question, how do you feel we should be able to merge success of these programs and effectively evaluate how they are affecting our productivity, our workforce's productivity? Each of you can, present your views. Maybe Santosh, we can start in with you.
All right. So measuring productivity is a very tricky question, right? So one given is that if your employee force is healthy, right, overall wellness quotient of your organization is very high, then obviously you are uh, bound to see good amount of productivity, right? Whether can you really measure the impact of a wellness program you have implemented on productivity? Probably not in the first year or two, but if you have data for for 5 years, if you sustain with the program and keep improving that every year, probably in 3 to 5 years time frame, you can definitely have some data points which will tell you that if you break them up, you can see the best contributors to the organization are also the most healthy population, right? So that I think you will definitely start seeing, which is very evident, right? It improves their morale, it improves their personal life, because they continue to be healthy. Their interaction and collaboration, their ability and interest to collaborate and share ideas improves, because you are in a great physical and mental space. With that, your colleagues start seeing a difference in the way you are contributing, right? So for us to measure that, it might take a couple of years of persistence and improving our offerings to our employees and having a robust system that can capture data over these periods, right? That is a challenge because we keep switching and cutting strategies, and we say, okay, this year we did this with this partner. Let's go to another partner next year because some just one other thing that is very exciting for us. So let's go give that to our employees and let's switch partner. But in this whole excitement of changing things, what happens is we might lose that flow of data that has come from the previous years, right? So my take on it is, if you persist with a strategy for a couple of years, beyond 2 years, right, you will start seeing data that will help you measure the impact wellness has had on productivity and performance of a group of individuals.
Well put, Santosh. Sanjeev, your thoughts on this?
Uh, uh, Agree that it will be little too early to actually measure it fully, but I believe that there are certain areas to start with what can actually measure, which will help in putting it to the management of the organization that why do you need to continue, because ultimately whatever initiatives you are doing there is a cost, and cost means there is a question. The C is always supported by Q. So to address it, probably one of the things to start with, which I agree with Santosh, is that maybe after 2-3 years, something more will come up. But one of the things would be that start with that organizations have whether it is WFO or if it's WFH, it is the most important thing is about the absenteeism or the participation of the employees. Probably the absenteeism due to the health thing, if the data of 365 days will help you that how many people have actually, because of this program, we started from June. So post June, what is the absenteeism rate because of the illness or health or welfare or health, or pre-June what was there? So the comparative data will help in pushing it or advocating it that see whatever we have started it, we need to continue with, or maybe we need to build up on it. Second is that on that also is about the again it is the productivity, which ultimately it is linked to that how many the employees, the performance of that. After that, the performance, how it has been made. You can link it to revenue, you can link it to EBITDA. That can be a add-on that can work as a cherry on the cake. But yes, initially to absenteeism, to the engagements, or to the participation of the employees, and even the managers can say that, okay, I can see that the employees, the same, if it is work from home, then that I'm finding the same kind of the excitement, same kind of participation of the employees because of the thing. Or in between, you can also do some kind of surveys and take the dipstick and do the dipstick and find out. So yes, it is the beginning. There will be lots of factors which can be evaluated, like what but maybe I'm thinking that maybe we like this is what we use it whenever we have to go for some kind of the wellness budgets. So we use this data, especially during the renewal of the insurance thing, because we in our insurance thing, I'm sure others would also be having, is that we cover the employees, their family, even the parents, and even their in-laws parents also. So so then also the question is that it's a huge. So these are the data which initially you can use it, but maybe after some time the things will evolve. To 2-3 years, it will evolve, and you will come out with lots of other factors to look into it.
Got it, Sanjeev. So I feel I think we've covered all aspects, and I don't see any questions on the chat board. So so thank you, Sanjeev. Thank you, Santosh. It's been a wonderful 40-45 minutes discussion. It's been very informative, and I'm sure our audience has a lot to take away from the session. I certainly have learned a lot from your experiences handling the changing landscape of healthcare. It's only through these discussions that employees and employers and us as HR professionals that we can meet in the middle and find a way to help each other. The future of workplace, of course, certainly starts with us, and it starts here and it starts now. People are the most valuable asset a company can have, and it always works out for the best if we are able to focus on employee wellness as a core aspect of organizational growth and rightly productivity. So thank you so much for joining us today. We look forward to have more such productive sessions. Over to you, Meghali.
Thank you, Mr. Sanjeev. Thank you, Mr. Santosh. And thank you, Ms. Deepika, for joining us today. It was indeed a great and knowledgeable session. And we surely look forward to more such conversations with ekincare and with you guys. And thank you so much for taking out time and joining us today. It was
Thank you for
pleasure
having
having
us.
you both.
Thank you
Thank
for
you.
having us. Thanks for the
Thank you,
invite.
guys. Thank you. Bye. Please
Bye-bye.
take care.
Have a nice day.